Karin is representing the School of Health and Population Sciences this afternoon, and the title of Karin's thesis is Prioritisation of Medical Devices for Low and Middle Income Settings. And the title of her talk today is What Medical Equipment Do We Really Need?
Hello, my name is Karin, and my PhD research focuses on the prioritization of medical equipment for low and middle income settings. Let me explain through the use of two examples. The first tells you a patient's story, and that is actually my grandfather's story. He lives in Romania, a middle income country in Eastern Europe. This picture was taken 1 year ago. At that time, he was still able to walk. Today, he is immobilized in bed due to a grave foot ulcer. The reason? He could not be diagnosed in a timely fashion because the medical equipment needed to do this was not available either at his local hospital or his regional hospital, so he had to travel 300 kilometers to receive diagnosis and treatment. The second picture is taken from a rural health facility in Gambia, a low-income country that I returned from on Tuesday. This is where the staff at this health facility keep their equipment, things like blood pressure machines, oxygen concentrators, glucometers, and even more substantial things like beds. The problem here is the staff at this facility is not skilled in the use of high-tech medical equipment or even in the repair of equipment, so a lot of their equipment lies unused. So what really is the issue? Well, low and middle income countries face a series of constraints. Financially, they have little budget to spend on equipment. Infrastructurally, they lack the roads to transport the equipment, they lack adequate storage areas, and by that I mean sterile storage areas. And also, in terms of human resources, they do not have the biomedical engineers to repair equipment in a timely fashion, or even the staff to always use the equipment appropriately. So what can I and my research do about this? Well, earlier this year, I initiated a collaboration with the World Health Organization Medical Devices Unit with leading health economists as well as biomedical engineers. Together, we are trying to determine what priority medical devices for low and middle income settings really are. And that means we're trying to set up criteria that are transparent, that would be able to indicate which devices should be actually bought in these facilities. Together, we are also trying to evaluate the use of innovative medical technologies, because sometimes innovation brings about quite a lot of savings. So, for example, we might invest in something like gene sequencing, which also might displace entire laboratories in middle-income countries and thus save a lot of cost and also save a lot of lives. Because at the end of the day, we really think that saving a human life is the most important thing. Thank you.